What sets me apart as a clinical psychologist is that I have an early career in program development, and that policy experience helps me treat a patient not just at the individual clinical level, but to understand their macro level barriers and their macro level needs. It helps me to implement change in a system so that my clinical work is more effective with these patients. Hi, I'm Alexis Rojas. I'm a clinical psychologist in the Department of Surgery, Division of Acute Care Surgery. Patients have unique needs in the acute care setting, and those needs are addressed by our team very specifically to help get in front of some of the trauma symptoms that they might be experiencing during the most difficult times of their life. That inpatient acute care treatment is different than the outpatient setting because the outpatient setting is what we like to call more follow-up or long-term care, and we will see those patients often weekly or bi-weekly for 6, 8, 12 weeks, and we have more longer-term goals in treatment, and we can unpack trauma and other experiences in a different way. When we're in the acute care setting, we have to focus on just stress tolerance in the moment and making sure that we're managing their needs then and there without unpacking historical traumas or getting into in-depth treatment. The role of psychology in acute care cannot be overstated. UF Health Jacksonville has a long history of being the first of its kind to implement surgical psychology services in their Department of Surgery. And because of this, we've been really the cutting edge of the future for psychology incorporated into acute care. And we've been able to set the standard. This is important because when we're treating a patient, we're not just treating the physical recovery of the patient, we're treating the psychological recovery as well, and those go hand in hand when optimizing a patient's health. What I enjoy most about working in critical care at UF Health Jacksonville is I have the opportunity to see patients who are coming in to our Trauma One with probably the worst experiences they've ever had in their life with some of the biggest barriers that need to be addressed. So it gives me the opportunity to really put all of my skills and training to use, all of the scientific knowledge I've learned, and work with all of my team members to help a patient get to a level of recovery that both they and maybe their family didn't think was possible.